This is a relay project.
Real Talk starts right now. Here's Ryan Jespersen.
We welcome you to a very special episode of Real Talk. The doctors are in the house. That's right, back by popular demand. The co-hosts of the Doc Talk podcast will be joining us for the next 40 minutes or so. We've got questions for Dr. Shazma, Mithani, Dr. Sheila, Wijayasinghe about Canada's measles outbreak, particularly bad in Alberta, but obviously concerning numbers across the country. We're going to follow up on a very powerful conversation about menopause that we had with Jesse Shuchuk just a couple of episodes ago. We'll get into that with the doctors. The response from you, Real Talkers, has been phenomenal. We want to thank you, Johnny and I do, for all of the episode sharing that you've been doing. We've been hearing from a bunch of new people to talk at RyanJespersen.com that have been hearing this episode, or this show, that for that matter, for the first time based on that subject matter. And we want to definitely talk to some medical doctors about that. We're going to talk about mental health post-pandemic. We're going to talk about misinformation in the health space and a whole lot more. That starts in 30 seconds. But before we get there, I want to let you know how happy we are to have our friends at We Know Training presenting this episode of the show. You know, in a world where credentials and compliance really matter, especially in regulated industries, healthcare is one of them. We Know Training is building something bigger than just training courses. They're creating the infrastructure of trust. And that means when somebody says they're certified, you can believe it. It's all backed by digital credentials that cannot be faked, and that's something that every industry needs right now. You can learn more about what they're doing at We Know Training and how it could apply to your workplace, to your industry, by visiting their website. That's WKT.ca. You'll find We Know Training online at WKT.ca. As we say hello to physicians, Dr. Shazma Mithani, joining us live in our Edmonton studio. It's wonderful to have you back, Doc. And Dr. Sheila Wijayasinghe, your podcasting partner. Dr. Sheila, where are you joining us from this morning? Where do we find you?
I'm in Toronto.
You're in Toronto. Are you at home right now? Are you in the hospital? You guys are around the clock, it seems.
I'm at home right now, but I'm going in this afternoon.
Oh, I love it. And you were just telling us, Shazma, that you're getting ready to work the long weekend in the ER.
Yes, I worked 2 out of 4 of the long weekend days, so getting ready for it. It's always a busy weekend, that first long weekend of the summer.
Oh man, we sure appreciate you guys. Yeah, I know we were I was at the NISCU Energy Show the other day, and they were doing a 50-50 there for everybody in attendance, and the proceeds from that 50-50 were going to the Star Air Ambulance, which provides, of course, an incredibly important service, a life-saving service in the prairie provinces. And people were making comments about how with the long weekend coming, we know that Stars is going to be flying. And I'm on one hand, you're going, gosh, we're lucky to have them. And on the other hand, you're going, man, it's really too bad that we have to acknowledge that long weekends come with an uptick in activity in the ERs and ambulances and the like.
Often a lot of traumatic injuries happen over the long weekend as well. People are out with their friends and their family, drinking alcohol or using other substances, and typically have impaired judgment when they're then operating things like ATVs or swimming. Lots of dangerous things that can happen over the long weekend.
I love this. We're doing like a PSA in the first 30 seconds of the conversation, but this is good. Who knows by talking about this?
Don't drink and swim. Don't drink and ride an ATV. Just, be at home. Be in your space if you're going to consume substances, and don't put yourself and other people at risk.
Yeah, I think for a lot of people too, the May long weekend might be the first time in a long time they're out on the dirt bikes or the side-by-sides or the quads, or maybe even getting the boats out. And, motorcycles will be out on the road for the first time this season, maybe. And a lot of times, as the bikers will tell you, it's not themselves that they worry about. It's all the cars and the trucks that are out there that haven't been used to seeing motorcycles out there too.
Yeah, absolutely.
Yeah. How's the podcast been going? The Doc Talk podcast has quickly risen to prominence. We've spoken with you both a couple of times before, and more close to your launch. Now we see you on the social. You're doing national news all the time. It's really caught on. What does that tell you about what you're doing?
It's been great. It tells me that Sheila and I have been able to fill the exact space that we were hoping to fill. We started this podcast to try to distill down health information. Between Sheila being a family doctor, myself being an emergency doctor, we can cover such a broad array of topics related to health. And, the idea to just simplify things, make them understandable for the general public, And the success of the first season has really showed us that this is a niche that is worth filling.
Well, we're looking forward. We're going to have our Real Talk live chat open, powered by Park Power today, and we've put it out to the audience if they have questions for you two to ask. We've let everybody know that you won't be doing any diagnoses on the show today.
Not today, nope.
Not today. Although Sheila, I don't know, maybe you're taking appointments at your clinic in Toronto, maybe. But we'll get to the big health stories that are making news, and then we'll see what the live chat has for us. But Sheila, we're seeing obviously a measles outbreak here in Alberta that's raising a lot of eyebrows and is real cause for concern. But across country, I think it's an issue as well. What's the reality in Toronto right now with measles?
Yeah, so our cases have surpassed 1,600 cases as of last week, and so what the numbers are rising. And Shazma and I have never seen measles in our careers. I've been in practice for 20 years. This is something that was considered to be something historic. We certainly learned about it in medical school and residency, but it's really very sad to see these numbers rising. I know in Alberta the numbers are over 400 now cases, and what we're seeing is there's hospitalizations associated with this as well. And so it's really unfortunate that we're seeing this, because this is a very preventable outbreak that's happening. It's a preventable crisis that's happening. And there's much that we can do in terms of vaccination and preventing this spread from continuing.
It's wild to hear you say that neither of you have even seen measles in your career up to this point. Why is that? Is this a vaccination story?
Absolutely. So as of 1998, measles was eradicated in Canada. And so like Sheila said, I've been in practice for a little over 10 years. She's been in practice for 20. And we learned about it in med school, saw the pictures, but had never seen a patient with measles because the vaccine is so effective. So getting 2 doses of your MMR vaccine is over 97% effective at preventing getting measles. The problem with measles in particular, because it is so easily spread, it's spread by airborne transmission, so really, really contagious, way more than COVID, more than, things like, or about the same level as things like chickenpox, like super, super contagious. So we need a much higher level of herd immunity. So 95% of people need to be vaccinated in order to protect the entire population. And we were at that level. It was eradicated in 98. And then unfortunately, with the increasing vaccine hesitancy, with the increasing vaccine mis and disinformation out there, we are seeing significantly lower rates of vaccination that has allowed this disease to resurge here in Canada.
Okay, so Dr. Sheila gave us the numbers in Ontario. Here are updated numbers. I'll reference reporting from Ken McGillivray with Global News. 14 new confirmed cases of measles. As we're talking to you on the 16th of May, 14 new cases over the past 24 hours rises the number in Alberta to a total of 409, 269 of them in the South Health Zone. The lion's share of them in the South Health Zone, Lethbridge, Medicine Hat, Tabor. More than 3/4 of the people diagnosed are children, and 3 in hospital in intensive care. What do measles symptoms look like, and what prompts a visit to the hospital? Is it high temperature?
Yes, there's a few different things that you would expect to see. So fever, yes. The classic rash that starts on the head and then kind of moves down the body into the torso and the limbs. You can get cough, runny nose, they're like red eyes, kind of watery eyes as well. And those are the initial kind of classic symptoms. But if you are someone who is at risk, and especially if you're someone that is under vaccinated, things like swelling of the brain, so encephalitis, that can happen in about 1 in 1,000 people. Swelling of the lungs and pneumonitis that can cause people to require a breathing tube and an ICU stay is also higher risk. And so there are significant complications from getting measles. It's not just another cold virus. That I think that is a bit of a pervasive story in the mis and disinformation space, but it is a dangerous illness that can have pretty significant consequences.
So it's Alberta and Ontario that are leading the country, the 2 highest cases, and that's not adjusted per capita. That's just straight up number of cases. And the measles outbreak in Canada now also being blamed for a public health alert in the United States, in the Seattle area of Washington State. Not exactly the type of influence we're looking to have, Sheila, but they're saying now that Canada and the U.S. are both at risk of losing the measles-free status that both countries have enjoyed for more than 20 years. Pretty wild stuff, and how quickly this can happen as well. In King County, Washington, if you check this out, they've been issuing public health alerts with times and locations that this one individual visited, an individual from Canada, in Renton, Bellevue, Seattle, Everett, and Woodinville, while infectious. I mean, this takes you back to kind of like early pandemic, where people were tracking locations and times. Everyone's trying to figure out if they were exposed.
But it's even worse than that, Ryan, because measles in particular that virus can stay airborne for hours after the person is left. So it's even worse, even more contagious. And that's why even in Alberta, in Ontario as well. You can see that whenever there's a new case, you see like, well, they went to, Walmart on this day or the airport on this day at this time, because it's in the air for hours afterwards. And so that's why it's so much more contagious as well.
Dr. Wijayasinghe, I think, is it fair to say that like a lot of the folks, and I certainly don't speak on behalf of anti-vaxxers, though we have sought to understand the perspective, some of the concerns around that COVID vaccine were the rapidity of its development, how quickly it was developed. They felt like it didn't go through the proper checks and balances, that it was developed quickly. Dr. Mithani, you're suppressing a smile right now. I'll hand the microphone over to the two of you. But Sheila, I'm curious to know, the MMR vaccine, the measles, mumps, rubella vaccine, it's been around forever. Like I would think if you were, the vaccine hesitancy for the COVID vaccine, you would think would not apply to vaccine hesitancy for others because there were different realities at play. How do you sort that out in your own brain?
Yeah, it's, the measles vaccine has been around forever, as you said, Ryan, and it's very safe. It's been well studied and established. It's used around the world a million times over, and it's very, very safe. I think what happened in the late 1990s, there was a clinician who has lost his actual license after doing this, but it ruined the reputation of the vaccine because he said that there was an association with developmental issues with the vaccine and in children. And as a result, they retracted that paper about 10 years after he came up with that paper. You have to look back at the history of that individual, though. He had his own vaccine that he was creating. He had a test kit that he was creating to look for this. He was profiting off of making this paper and doing this very false claim that basically shifted how we saw this vaccine and sort of was a seed of doubt for the MMR vaccine. And unfortunately, as a result, that message has remained, although we are trying to combat that message because it is not true. Again, his license was removed. He's no longer practicing because of these issues that came up. And it's really unfortunate because it is a very safe vaccine. We use it really often. When I work with my patients, I do have patients who ask questions about this, and very validly, I think patients have a right to ask about safety and understanding why we're recommending something. And I always work with them to say, listen, you're looking to protect your kids as much as possible from this disease that has potential complications. I'm also doing the same thing. And we need to figure out how to work together and combat that misinformation because it's not true. The MMR vaccine is very safe. And this is something that we've used for years on end. And so that's really where we're at with this. We really need to shift that thought process and understand that this is something that's very safe and effective, and the only way that we're going to prevent these outbreaks and the complications that come with measles. Shazma mentioned the long-term complications of measles being the potential, not the long-term, but the potential hospitalization and death that can happen. But also we have effect on our immune system with measles. Measles tends to prevent you from remembering your reactions to previous infections that you've had. So there's almost like an amnesia that happens with your immune system if you get infected with measles potentially. And that's something else that when you get measles, it's not just a benign illness. You might actually, your body may not remember that you've had other infections. And as a result, those other infections may have more severe consequences in your health as well. Mm-hmm. And so there's multiple reasons why, but the vaccine is very safe.
I couldn't agree more. And then, this really just highlights how dangerous mis and disinformation is. The study that Sheila was referring to, this person, Andrew Wakefield, he is no longer a physician. He had his license revoked. In fact, he was found to have been falsifying the data that he used to claim that vaccines cause autism. It does not. I will say it. The MMR vaccine does not cause autism. It is safe. It is effective. And it is the best way we can prevent measles and the complications of it.
But you know how this road goes, right? Like he loses his license to practice, and then all of a sudden it justifies, he's a martyr.
Exactly.
All of a sudden the establishment, the machine can't handle the truth. They're forcing him out, and then it almost validifies or it almost strengthens his argument in a ridiculous way.
Absolutely. And the damage is already done, right? There was so much momentum there with this narrative that he had painted for, like Sheila said, his own benefit. He was financially benefiting from this. And this is such an important question to ask in this space. If somebody is financially benefiting from the information they're putting out to you, always question it. We're seeing in the United States right now, RFK Jr. is now deciding that he's going to find the cause of autism by September. Which is just feeding into this false narrative and this mis and disinformation and continuing to sow mistrust in the medical establishment when, like Sheila said, the same way that parents and patients want the best for themselves, we also want that. We're all on the same page here. and just trying to find a way to navigate through this misinformation space with them.
Measles can be fatal. Yes, no?
Yes.
And can cause permanent brain damage. And
Yeah, it can cause permanent brain damage. It can cause permanent lung damage. It can cause significant consequences to your immune system. Like Sheila mentioned, it can make you quite severely immunocompromised and put you at risk of getting a separate infection that can then cause a lot of harm and death as well.
It's never too late. I mean, aside from maybe when you have measles, but it's never too late to get the vaccine, right? You could get it at age 12 or 25 or 35 or 60.
Correct.
Okay. What role do you think, I mean, and we'll note that this is happening in other jurisdictions as well. Down in the state of Texas, they're experiencing more than 700 cases, and I've seen in reading up on it before we talked, the health experts down there believe that the number is dramatically higher than what's being reported. And you can kind of look at some of the jurisdictions. It's like the Great Plains, basically. It's like Alberta all the way down to Texas where this is happening, where we see probably the highest instances of vaccine hesitancy. What role do you both think that governments should play in all of this? Why don't we start here at home? What should the Alberta government be doing right now, Shazma?
Well, I was happy to see, what was it, a week and a half ago, that the government has finally come out and said everybody should get their MMR vaccine if they don't. I wish that it happened sooner, but at least it's happening now. There's a lot of trust that is put in governments by constituents of a particular jurisdiction, and I think they have an immense role to play in public health in particular, because people don't always, tune into podcasts, read the news, but they will often look at their government officials, and the narrative that they are speaking and painting has an immense impact on the trust in the healthcare system that the broader population has. So I think that they need to be much part of the conversation and tell people that vaccines are safe, they're effective, that they should be getting them, and it's the best way to prevent measles. And thankfully in Alberta, we are finally seeing that now.
Dr. Sheila, what's the Ontario government been doing? The federal government, I feel like it's still kind of finding its legs right now, although not to say that like the public health in Canada ceases to operate through an election campaign or early in a new government. But what are you seeing from the Ford government and anything from the feds that's given you reason to believe they're on the right track?
Yeah, similarly, I think everyone's recognizing this is a collective responsibility that we have to each other to protect the most vulnerable, and making those statements that it is important to get vaccinated, protect your families, protect each other. There are many people in our population who are vulnerable to the long-term and short-term effects of measles, and it's all our collective responsibility to be a part of that change and get vaccinated if you are due for that or you need to get vaccinated. And I think the government speaking up, as Shaz said, is really a key part of that. That's certainly what's happening in Ontario. I really appreciate seeing this sort of messaging. It affirms when people come into the office. A lot of people are coming in because they heard it from our government officials and they say, I think I might be due. And I really appreciate that, because it does show the trust that's there and the need to take action and collectively combat this together.
It's great to see Stephen Van Nieuwkerk in the live chat. He's a counselor down in Beaumont, just south of Edmonton. He says in some smaller Alberta communities, we're hearing talk that doctors are not as trusted as they once were. We know that's a fact, that trust has been waning, not just in the medical profession, in journalism, in law, in post-secondary institutions, generally speaking. Do you see evidence of that, like on the front line, Shazma?
Yes, however, yes, I do. However, the latest Ipsos data on like the trust index that they put out every year, doctors are still first or second, like right at the top of it. Journalists are still up there. And it's interesting. Social media influencers, politicians are actually near the bottom. And so, yes, although I anecdotally feel that there is a drop in trust or more questioning, which I think is very appropriate, like ask the questions. I'm happy to answer them. Thankfully, doctors and healthcare workers are still generally very trusted among the population.
Like, as they should be.
As they should, yes. As
Can
they
somebody
should
say
be.
it?
Thank you.
As
Thank
they
you
should
for
be.
saying it.
Yeah.
I'm glad you said ask you questions and you'll answer them, because I have one. How does I know Ryan's rifling off the names of these places in Alberta where we have these cases, Tofield, Tabor, Medicine Hat, Lethbridge. How does, and I'm not painting anyone with fault, but how does the religious aspect, I know there's some vaccine hesitancy there in Mennonite communities and things like that, does that factor in at all to these numbers we're seeing in Alberta?
Unfortunately, yes. So there are religious groups where we're seeing a much larger number of cases because of the vaccine hesitancy that exists there, or because of some religious beliefs. And I think our role as healthcare providers in these situations is to, hear them, answer their questions, be available for whatever information they need, gain that trust, and kind of start with where they're at, meet them where they're at, start with that as a foundation point, and then build from that. Because a lot of that is also just, misinformation that's been passed down for generations, and they haven't been told any different. So I certainly can't blame the people who are not getting vaccines. I never blame them. I blame the system around them that is feeding that misinformation and disinformation to them.
Dr. Sheila, 100 Nights is in our live chat right now, powered by Park Power, your friendly local utilities provider. Wonders, where did all the measles come from? If Canada was measles free, where did it come from?
So we think it's from travel from other places around the world where measles is still present. So we held that status of not having measles here since 1998, but we know that travel and being part of our global community, measles comes into our country in different ways, similar to other diseases. And so generally, again, if our herd immunity is up beyond that 95%, we can keep those numbers low or non-existent. But because our vaccination rates have gone down, unfortunately, even cases coming across the border or from overseas can influence and trigger an outbreak to happen.
So Les says, I've had it once. As a young person, can I get it again? James says, as a mid-Gen Xer, I got my MMR vaccine quite some time ago. He says, I'd love to get a booster. What would you say to Les and James?
If you've had measles, like confirmed measles, you have lifelong immunity after that. It's not the best way to get immunity, of course, because there is a risk of complications. But if you have had measles, so anyone born kind of before 1970 is thought to be protected because measles was so ubiquitous at that time that almost certainly they would have been exposed to or had it. So they're considered immune. Anyone born after 1970 is at risk because measles had started to be eradicated by that point or much lower numbers. And so immunity is 2 doses of the MMR vaccine. So it's important to have 2 doses, and that is considered effective. There are some populations, like healthcare workers, for example, where a 3rd dose may be necessary, but in general, it's 2 doses and you're considered protected.
Okay, we've got questions about masking. We've got questions about polio. We're going to get into more with these two. We're talking to Dr. Sheila Wijayasinghe and Dr. Shazma Mithani, the two of them co-hosts of the Doc Talk podcast, which you can find everywhere you get your podcasts, including on Spotify, Apple Podcasts, and of course, iHeartRadio. Make sure you subscribe. Make sure you rate their podcast after you listen to it. That's a way to really help out content creators like these two and like us, for that matter. More from them in less than 2 minutes. First, I want to make sure that UCAN Youth Services is on your radar. I had a chance to visit this incredible crew less than 24 hours ago to watch them in action. This is a nonprofit charitable organization dedicated to helping young people out of harm's way and onto a path of economic independence. And there is some news. There is some news coming that is not my news to share, but very, very exciting stuff about the work that UCAN is doing. We're going to tell you all about it starting in the month of June. But right now, if you know a young person aged 18 to 24 that's maybe running in an unproductive peer group, let's say, that maybe has a ton of potential, but they failed to capitalize on it. All they need is an opportunity, somebody to believe in them. The Road to Work program through UCAN is designed to help youth get the skills and safety trainings they need to enter the construction, roadwork, and traffic safety sectors. They're going to teach you how to run a saw. They're going to teach you how to run hydraulic tools. They're going to teach you the basics so you can walk onto a job site, probably with job placement, and start earning a reliable wage. That's just one of the things they're doing at UCAN Youth Services. You can find them online at ucan.ca. California Closets, the best in the business in custom closets and storage solutions for the whole home, and proudly Canadian-owned and operated. You can check out their amazing work on their website. That's californiaclosets.ca, including what they're doing for people's garages right now. You may be thinking of the primary bedroom walk-in closet when you think of California Closets, but their garage storage cabinets will transform that one space in your house that may get neglected more than anywhere else. Enjoy spending time in your garage. Find yourself able to find the tools you need. How about that? Honey, where's the garden hose? No longer when you have a garage custom designed and installed, guaranteed for life by the team at California Closets. You can request your free consultation today. Our friends at the Edmonton Chamber of Commerce have a lot going on. There's a lot of benefits of membership, including their Chamber After Hours event and their recent Chai with the Chamber event. That's coming up on the 23rd of May. You're not going to want to miss that one. That's a big one. The Edmonton Chamber of Commerce is making it possible for the movers and shakers in business in the Metro Edmonton region to connect with one of each other, to share their expertise, and of course to support their community. Your business's most valuable investment will be a membership in the Edmonton Chamber of Commerce, and you can learn more about it or sign up today. Join us here at Relay at edmontonchamber.com. And our friends at the Rainbow Visions Film Festival want to make sure that they're on your radar this weekend on the heels of Northwest Film Fest. That's Canada's longest-running documentary film festival. The Rainbow Visions Film Festival, Canada's largest LGBTQ2S plus film festival, running today and tomorrow and Sunday. You can check out the full lineup. You can get your tickets today. These are some of the films that have been gleaning buzz from all around the world, including the biggest festivals like South by Southwest. Well, now they're right here in the Metro Edmonton region. Tickets available. You can view the full lineup by checking out rainbowvisions.ca. Bunny Slippers in our live chat as we're talking with Dr. Sheila Wijayasinghe and Dr. Shazma Mithani. Bunny Slippers says, I swear, if this vaccine hesitancy prompts me into having to worry about polio again, and you take a deep breath, because all of a sudden things like whooping cough and diphtheria and polio, it feels like they're back on the table, are they?
Yeah, the short answer is yes. I mean, so polio was eradicated in Canada also in the 1990s, 1994. And as vaccine hesitancy grows, it's not just, I mean, you know, you talked about the COVID vaccine earlier in the episode. The MMR vaccine hesitancy is there as well, but it kind of bleeds into other vaccines as well in terms of the general hesitancy. And as we start dropping our rates of vaccination, that herd immunity that we are looking for to protect the people who are, you know, too young to get vaccinated, or, you know, have like legitimate anaphylactic allergies to vaccines, or are so immunocompromised that it's actually not safe for them to get a vaccine, we are letting all of those people down because we can't protect them unless the herd immunity is enough. And as that vaccine hesitancy rises, those vaccine rates will continue to fall, and we are very much at risk of having other eradicated diseases start to come back.
Dr. Sheila, what do you say? Like, you're a family doctor. These are family docs. I've told you before, I'm the son of a family doctor, and I've seen family docs in action. You are on the front lines. You're in the relationship building business. You see, in some instances, potentially patients from cradle to grave in some circumstances. What do these conversations look like as you respect your patient's medical autonomy, but at the same time you understand as a professional what you know to be best for them? How do you address this face-to-face in your practice?
Yeah, I think one of the beautiful parts about being a family doctor is exactly that, where we build relationships over our patients' lifetimes. And I see my patients as my family in a way, right? Like, I want the best for them. I want them to be healthy and safe and to thrive in their lives. And that is the messaging that I use with my patients. And that's, again, because I have a trusted relationship with my patients. I feel like they can be honest with me when they're not sure about doing something for their health. And so we really delve into it, and I say, okay, tell me what is worrying you. And often right now what we're seeing is a lot of this mis and disinformation that we're seeing online. Patients will come in to talk about that. And so we'll go through all of it. And I'll say, okay, here, tell me what you're worried about. Let me see what I can do to help reassure you based on what we know currently, based on the evidence. And again, I always affirm to them, my goal is for you to be healthy and well and safe for you and your family. And I'm not pushing something on you that doesn't have evidence. The challenge is that evidence-based medicine and talking about things that work and don't work and don't have evidence behind them is not super sexy. And so the things that I'm trying to share with my patients it's not as catchy as what we see online and in that misinformation age that we're in. And so it takes a lot of time on our part as healthcare providers to sit down, understand where patients' concerns are, and then get to the root of that, and then address their questions, and hopefully then reassure them to make the decisions that are right for them. And patients do have autonomy. Everyone has the right to make the decision that's right for themselves and for their family, but I'm hoping that they make that decision based on evidence-based information that's clear, compassionate, and understands where their goals are. And so it does take time. And the challenge is right now, there's, over 6 million Canadians don't have a family doctor. And so to have a trusted relationship with a healthcare provider is a luxury for many. And that's something that we're trying to address as well. And I think that when we address that lack of primary care or family doctors or nurse practitioners who do this care, that's going to start to address some of this misinformation, because then we can really have those trusted conversations where not everybody has access to that right now, unfortunately.
Michael in our live chat says the only reason that the Alberta government finally started to encourage the measles vaccine is because it's become such a problem. Says, I miss the days of proactive public health care. Tracy says this is being talked about in business circles. Measles is. She says we managed to convince at least 24 young adults to get vaccinated before their summer vacations, which is good. Super Chat Ken says the negative power of social media. Wow. He says measles, Brexit, Donald Trump. He says it's also why this 51% separatist vote is possible. And the Premier of Alberta knows it. When the time comes, people need to speak out and vote for Canada. This is, a lot of people are going to be having conversations with Sheila. I appreciate you equipping us with some tips on these one-on-ones, because that there will be next door neighbors. There's going to be like parents that are doing school drop-off or school pickup together that are having these conversations themselves. Maybe there's a measles outbreak at the school, and it prompts conversation between the parents or the teachers there, right?
Yeah, and those individual relationships, though, are so valuable. That is one of the ways that misinformation, so again, like misinformation is when it's information that is not malicious, right? Like you're just taking information in that you think is correct and you're sharing it and spreading around, versus disinformation is when there's malice and malintent there. But that's exactly how misinformation spreads. My friend or my cousin or my aunt or uncle or mom that, I hang out with at school pickup sends me an article that is compelling to him or her. And because it's from someone trusted, I'm putting value in it. And so that's why those individual relationships are so important. And like Sheila mentioned, being informed by evidence is so important as well, because then that kind of information is what's cutting through that noise of misinformation. And like, those one-on-one relationships are so valuable to have those conversations. And hopefully, as we have more conversations like this, the actual scientific information is what is being discussed in those circles.
Doctor, I've learned from your colleague here that you're an expert in menopause. And we had a really interesting conversation with a friend of the show just a couple of episodes ago, and it prompted big audience response. And we promised this audience that we would put this in front of the doctors. And so I want to do that in just a quick second. But recognizing that maybe not all of you had a chance to hear or to see Jessie Shuchuk on the show, here's a summary. Here's the best 60 seconds from what she had to say about
1 billion
menopause.
women are in menopause. I found myself in a place of suicidal ideation. It was my daughter who came and sat on the side of my bed and said, "Mommy, do I need to call someone?" After I had been in bed crying relentlessly for 2 days. I had been experiencing night sweats, insomnia that would wake me up between 2 and 4 a.m. with panic, brain race. I couldn't get back to sleep, loss of confidence. I just didn't feel like myself. Something was very, very wrong. Our mothers, it was very, very hush hush. We don't talk about this. We just grin and bear it. Let's put our big girl panties on. Gen X is saying, no way. Like, we are talking about this. We don't want to show up in this way. We want to show up in the way that we used to be able to. Women are owed centuries of research. Up until the late 1900s, research for women's health was actually being conducted on men. Asking for help and get educated. There's a really one and the same. Finding the right.
That was Jessie Shuchuk on the show. Goes on to basically say finding the right information, finding the right education is a wonderful place to start. It prompted an email. I want to read this from Denise, and then we'll hand it over to the doctors. Denise wrote into talk@ryanjespersen.com. She says, I had to hit pause 3 different times while I was listening to the May 13th episode with Jessie talking about menopause. And the third time I hit pause was to write this email. The first couple times were because I burst into tears and I didn't want to miss anything while trying to get myself back together. She says, I won't get into specifics with my symptoms and my struggles, but your guest hit the nail on the head with her dialogue on how much menopause is just not studied and not really discussed in any capacity. Denise says, including in my own doctor's office. She says, I was prescribed antidepressants for the hot flashes a few years back. I was told that hormone replacement therapy was dangerous by my female physician, who's only a few years younger than me at 54. She says, my life's been upside down, to put it mildly. It all started 5 years ago. No relief in sight. She says, although I did start a form of hormone replacement therapy a week ago, and my fingers are crossed. She says, the tears I'm experiencing are tears of relief, knowing I'm not alone, knowing that I'm not crazy, knowing that I'm not exaggerating. She says, I can't thank you enough for having Jesse on the show. She says, I've listened to every episode. Thank you very much, she says, since the very early days of Real Talk. She says, I love the show, and it keeps me informed on things that matter. Sheila, let's get into this. We obviously knew that we were on to something early when the live chat exploded during this conversation. This is something, obviously, that you've seen many, many times.
Absolutely. And I appreciate so much that you had that. I watched that conversation as well. And it was so powerful to sort of hear a patient's perspective and how they're advocating for change, because menopause and women's health in general is an area that has been ignored for many years. She mentioned research, 6% of all medical research is done on women, and we make up more than 50% of the population. And that really is part of one of the reasons why we don't talk about this enough. And myself as well, I went through medical school. I went to U of A. I'm from Edmonton as well. And so I went to U of A, and in medical school, maybe we got about 30 or 40 minutes on menopause. And I went to medical school at the time when there was a large scale study that shifted things overnight in 2002 called the Women's Health Initiative, where basically overnight, it was a study that actually overinterpreted and overestimated the risk of hormone therapy. And as a result, the headline screamed, no one should be on hormone therapy, no one should be treated. And overnight, we were told as medical providers to stop prescribing and don't even ask about menopause because we don't have something that can help our patients. And as a result, there have been 2 decades of patients and providers, healthcare providers, who have been afraid to prescribe appropriately safe medications that can really make a huge impact for our patients' lives, especially at this stage in their life. In midlife, we are carrying so many responsibilities. We are in potentially the peak of our careers. We are carrying responsibilities of caring for potentially children or aging parents, and our own health can change during this time. And dealing with the symptoms of menopause can also add to that. And what we've done for years is ignore that and not even address it. And this is changing. And I think this is changing based on that Gen X comment that Jesse made, that we're a group where I'm part of this generation as well. We are standing up, we're saying no more, we need this help, and something has to be done. And I do believe this is changing, but it takes time to make that change. So talking about it like we're doing today makes such an impact, to know that you have rights as a patient to get support. You do not have to suffer through menopause or perimenopause symptoms, which is the time leading up to menopause. You can also have symptoms, and there are options available that are really excellent and very safe. And this is part of my mission. This is why I went back. I had to unlearn everything I learned in medical school and residency about menopause to be able to provide this care to my patients. And seeing my patients do well with good treatment is incredible. They are themselves again. They feel more capable of being a part of their communities and working, because of many people, as the individual who wrote in, Denise, said, you don't feel like yourself and you're suffering. And there are many things we can do to support you.
It'll come as no surprise to you that I was learning like every 30 seconds that we were talking about it. But Jessie was very articulate and expressing, she's like, this is not just a women's health issue. This is something that everybody needs to understand more about, obviously. Mm-hmm. But I wasn't even familiar with perimenopause, and you can understand why somebody, and obviously it would differ for every woman or every person, but you don't have menopause on your radar probably when you're like 32 or 33 or 34, right?
No.
It's probably not the number one thing you think of when you don't feel like yourself.
Yeah, and I mean, to Sheila's point, we didn't learn a lot about this in medical school. And in general, the thought is, well, menopause happens in your 50s and later. And nobody ever talked about perimenopause, which is this time where we know leading up to when you actually stop menstruating, that there are significant changes in your hormones and physiologic effects of that. But that was never a part of the conversation. And we're only just starting to now, like Sheila's mentioned, like Jessie mentioned as well, people are starting to experience symptoms in their 30s, into their 40s, and then into their 50s as they approach menopause. And I think it's so great that we're starting to actually have conversations about this. Ryan, as you alluded to, it's important to have male allies in this space as well. It's certainly probably important for my husband to know about this too, to know how to navigate the space. You for Carrie too, right? It's important to have these conversations so that we can support each other and have allies in this space. And I think one other important thing to keep in mind, we've been talking about misinformation today. we all know that health is so vulnerable, and like women's health is ripe for the picking in terms of people getting in there, wellness coaches, people who are not certified and don't actually have their menopause certification can get in there and sell the supplements and try to, you know, make people feel like there is a quick fix to this. First of all, there isn't. And second of all, you should always question that, right? And so if you are someone who is experiencing symptoms of perimenopause or menopause, or you think you are, it's important to look for a provider that has their menopause certification and actually knows what they're talking about. So there are physicians in that space, there are nurse practitioners in that space, but there are also lots of other people out there who are not actually certified providers that just want to sell you something that's going to make them money, that probably is only going to have a negative impact on your wallet and potentially even on a negative impact on your health because it's not something that is well studied or evidence based.
Speaking of nurse practitioners, Cheryl outside in our live chat says, I just wanted to thank the doctors for mentioning nurse practitioners. She says, when I lost my doctor through patient cutbacks, I went and visited a nurse practitioner who's been a really good fit for routine care and a great health advocate. I know that there was some cynicism or some concerns around the politics of all of this. The Alberta government, I think, was sort of broadening the scope of practice for nurse practitioners a couple of years ago, I think it was, off the top of my head. I'm referencing my memory, which is a dangerous exercise. How is that all playing out in practice? I mean, you mentioned, Sheila, across the country, 6 million Canadians can't find family doctors. I know there's, in our home province, thousands and thousands. I was one until a few months ago where I finally found one. Are you seeing evidence that relationship or that change in scope of practice is paying off, or do you still have concerns, or did you ever?
I work with great nurse practitioners in the emergency department at all of the sites that I work at. And I think that nurse practitioners as a part of a healthcare team is such a valuable way to fill the gaps and to make sure that as many Canadians as possible have access to care. And I'm seeing people who come in that are directly benefiting from that team-based care. That's
great. Before we thank you for your time, and I know we've got to let you, like, some guests, we can keep them here all day because they're just going to go play golf after or something like that. You two need to be like in ERs and in your clinics and saving people's lives, so we'll respect the time. But I do want to ask you about this in closing. Dr. Sheila, recent data indicating that mental health in Canada, the reality, they're saying that the instances and the severity of it up to 3 times worse than pre-pandemic levels. Are you seeing evidence of this in your practice? And if so, how are you addressing the surge in the need for mental health care within your own practice?
Yeah, absolutely. I think we really focused on mental health during the pandemic because we knew that we were isolated and we were isolating from each other, and social connection is such a big part of our mental health. But then what we didn't expect so much was the post-pandemic mental health crisis that has happened. And because we assumed that when we were able to reconnect and see our loved ones or our friends or be out in public, that would sort of lift some of the heaviness of the time. But the reality is that I've seen such an increase in my own practice. We know that with the numbers across the country, that rates of depression, anxiety, and otherwise have actually risen. And so it's really unfortunate to see this. What we do in our practice is we really focus on addressing it, talking about it, acknowledging that this is a hard time. The world is hard right now. And I think that's a part of it, is that we are living in a time that can feel very uncertain. Economic instability is very real. Food insecurity is very real. And when we don't have those basic necessities met, understandably, you're going to have mental health struggles as well. And so what we do, our practice is a little bit unique, where we actually do talk about the social determinants of health very often. We talk about income, food support, and other things that are the basics to really address that. And then when we talk about mental health, we really try to enlist the support. Shazma mentioned, like, the team-based care is really important. So nurse practitioners are a part of our team as well, but we have psychologists on our team. We have therapists on our team who really address sort of the mental health needs of our practice together alongside. And then in those situations that people may need pharmacotherapy or medication to help them, that's something else that we also add to what will be helpful for them. And so it's really sort of a process, but the first step is really talking about it. You're not alone in feeling this way. Many Canadians are suffering right now because of the state of the world, but also mental health itself is just something that also we sometimes live with because of our own genetic predisposition or otherwise. it's something that we don't talk about enough. So I think talking about it, addressing it, and getting that support are really key, and reaching out to those supports. And there's virtual supports as well that are really helpful, and going through workplaces. And otherwise, if you are working, that's another option. So there's many different ways, but the first step is talking about it like we're doing today.
Yeah, well said. Your frame of reference a little bit different. You're in the ER, and I always reference, your work in the emergency room at the Royal Alexandra Hospital for people outside the Metro Edmonton region. That is Edmonton's urban hospital. It's one of the busiest hospitals in Canada, and you serve a very diverse population at the Royal Alex. But you're also in the ER at the Stollery Children's Hospital, so you've got a really interesting kind of dual perspective there. How do you answer the same question?
I mean, I think it highlights the importance of primary and preventative care. We've kind of already been talking about that theme throughout the episode. When I see people in the emergency department, it's because it's providing this emergency episodic care, because they have either fallen through the cracks or they're in crisis, and I provide Band-Aid solutions and temporize them and try to get them some outpatient follow-up. But it really highlights the importance of having team-based care, having a provider who can support you in the community and kind of continue to support you to ideally avoid crisis. That's the goal, right? That's the dream, that every Canadian has access to a medical home and a team around them to help support not only their mental health, but the rest of their health as well, so that they are not coming into Emerge to see me, are not getting admitted to hospital, are not presenting in crisis, because everything about their health has been holistically taken care of by this team in the community. And I hope that we can get there. We're starting to have these conversations at a provincial level, certainly at a federal level as well, where team-based care is starting to be the focus, and the goal is to get every Canadian access to that in some way.
I wanted to squeeze in a quick question from Idris, who was wondering, for folks that aren't able to get in to see a family doctor, can pharmacists administer the MMR vaccine? Do you know?
Yes, they can. Yep.
Okay.
So many and most pharmacists can administer vaccines in Alberta. Currently, it is anyone over the age of 5, but that age is going to get lower, I believe, in 2026. So yes, please see your pharmacist. They can give you the vaccination, and that's a great way to access that.
Lauren says, real talk with real doctors. I love that. Very well said, Lauren. We also have Justin in here, who's just wanted to convey a huge thanks, he says, to both doctors, Sheila, Shazma. It's so important these days to combat misinformation and disinformation in the healthcare space. People's lives are literally at risk, and vaccines are safe. Justin says, get your shots, people, all caps. I wanted to give it a little extra oomph.
I love it.
To reflect the all caps. Real Talkers, we want to ask you right now to go ahead and wherever you get your podcast, subscribe to the Doc Talk podcast on Apple Podcasts, Spotify, and elsewhere. You can also find them, both doctors, with their individual accounts plus their pod account on Instagram. We'll link to all of that in the show notes on the podcast and on YouTube. Of course, Dr. Sheila Wijayasinghe joining us from Toronto, Dr. Shazma Mithani in our downtown Edmonton studio. Thank you both, not just for your healthcare work, obviously, but your advocacy work as well. We really appreciate it.
Thanks for having us today.
Thank you for having us.
Thanks, doctors. This conversation made possible with the support of Real Talk partners like our friends at North Road Investment Council. We've talked a lot about taking care of your family on the healthcare front. What about protecting your family's investments? The team at North Road understands that a whole bunch of you may be lying awake at night, or maybe sitting in traffic, asking these questions in your own mind. Do I have enough to retire? Are my savings adequate to retire, or am I fooling myself? What happens to my spouse if something happens to me? How do I protect my savings from taxes or inflation or a market crash? If these questions are troubling you, or if you don't even know which questions to ask, then it's probably time to talk to the team at North Road Investment Council. Their certified financial planners and chartered financial analysts can answer your biggest retirement and financial planning questions. They're independent fiduciaries who pay, you're going to pay them a per hour fee. They're not being paid commissions for selling you investment products. So that's just one of the things that makes them different. There's no fluff. There's no pressure. There's just clear advice and strategies that make sense. You can visit North Road Investment Council online at northroadic.com to book an appointment and get the answers to your burning questions. Our friends at Friesen Brothers ready to welcome you this weekend. Maybe you're having folks over for a May-long weekend barbecue and you want to put something special on the grill. Maybe you're looking for fresh produce. Maybe you're going to visit a Friesen Brothers garden center. Those are open right now. Friesen Brothers established 70 years ago, a butcher shop in Hinton, Alberta. Still family owned today. They've grown to 16 different locations, but they're restoring the lost art of butchery by training a new generation of skilled butchers using time-honored techniques. Their craftsmanship delivering exceptional cuts of dry-aged Alberta beef, known for its rich flavor and tenderness. You know, you can pick up options 30, 60, even 90 days aged. The longer it's aged, the deeper and more distinct that flavor becomes. I recommend you do what I do. Go in and just shoot the breeze with a Friesen Brothers butcher. Ask them what they would serve their friends at the barbecue. You can order a custom cut if you like. We did a prime rib. Johnny, we did an 11-pound prime rib a while ago to feed a whole bunch of people. It was unbelievable. Friesen Brothers Butchers, making a difference in every bite. You can find them online at friesen.com. If this weekend or into next week you are resolving to find new employment, it's either been too long out of work or maybe you're just sick of where you're at, the team at Solar by Kuby's hiring right now. They want you to know at kuby.ca, that's Kuby.ca, they've got all of their career opportunities posted. This is Western Canada's fastest growing solar company, and they've got openings right now in BC, Alberta. They've even got one in Ontario right now, in Ottawa, for a direct solar sales expert. If you're an engineer, if you're an installer, if you've got your ticket, if you're an apprentice, if you work in HR, office management, Kuby wants to talk to you. You can contact them today for employment or for a free solar quote. Again, that's at Kuby.ca. I didn't present the full email, John, from Denise, who wrote in to talk about menopause.
Yeah.
Because it was a little out of context, but I made a note to myself. I scribbled down a note to circle back to Denise's email because she also added in a bit, a specific request to say hello to you. Denise says, I will be there on June 21st when Johnny Infamous MCs another wonderful fundraiser for Farm Rescue.
Oh, yeah.
She says, we love you, Johnny, and she says, we can't wait to see you there. So,
Yeah.
what's that all about?
Farm is, I've talked about this on the show. Thanks for giving them a shout out. They rescue, basically, you know, when these farm animals do their jobs and they're done and they're retired and all is said and done, a lot of them are put down or put to pasture or whatever. You know, they can't be used for food, most of them, because they're elderly or whatever. Farm takes them in and gives them a rest. The golden years of their life are spent on this farm. So you've got pigs, you've got cattle, you've got goats, you've got cats, you've got dogs. Basically, all the undesirables of the world, all the riffraff. So it's a really cool group of animals when you go there. Like, they're just happy to be outside and in the sun and being taken care of in a stage of their life where a lot of them would be euthanized. It's just. And they rely totally on donation, and that's their entire life, is just giving these animals the best last stage of their life they can. It's a pretty heartwarming thing to go there and know that these people are that's what they're dedicating their lives to. It's awesome.
I'm not surprised you're involved in that. You got Johnny's got
oh man, any chance to hang out with goats and cows and chickens?
Well, I just meant the size of your heart, man. The size of your heart. I'm not surprised at all, and I think that's fantastic. Wanted to acknowledge a couple of things, and we sure appreciate everybody that watches us live and that contributes to the chat. There was kind of this recurring theme in the chat in the context of measles, and people are asking, well, where does the measles come from? And there's a lot of people in the chat going, well, you know where I'm going, talking about immigration. Yeah. So number one, there's nothing wrong with questioning Canada's immigration policies. It's a healthy thing to do. Mark Carney's already cutting back on it, and I think that, like, we have acknowledged that Canada needs to have immigration policy that works, right? I also note that, Scarlett, for example, in the chat says, she goes, I try to be open-minded with people I don't agree with in this chat, but to scapegoat immigrants for the measles outbreak is a new low. Here's what I would say to that is, like, number one, it is entirely possible that new Canadians, brought measles into Canada or contributed to an exacerbation of or an outbreak of measles. It's also possible that a visitor to Canada, that a tourist, and guess what? They could be white, right? it's possible that a visitor to Canada, somebody that was visiting for a short period of time, maybe to get out to the mountains or maybe to play some golf in Nova Scotia or whatever it is, maybe they're responsible. But the fact of the matter is, and if that prompts conversation on does Canada need better screening at customs, is there a better way to do things, then there's absolutely nothing wrong with asking those questions. But I will say this, when it all boils down to it, measles are here, and what are we going to do about it? And that's the number one question that we have to ask, and that's why I think that the conversation with these two, one of the reasons why it was so important.
I think if we knew that, we'd be addressing it, and that's not what we're seeing here. That's why I brought up the question with the doctors. I mean, we're seeing these outbreaks in the south zone of Alberta. We're also seeing it in small communities where immigrants don't usually settle. They usually flock to urban areas, or at least, more populated areas like Edmonton, Calgary, the outskirts, Leduc, wherever. We're seeing these in small communities, Ryan, very small communities. And the majority of it we're seeing in places where there's vaccine hesitancy. So, I mean, if you want to follow lines, there's the lines right there.
Yeah, absolutely. Idris says the interview is an absolute master class. Says a great show team. Sometimes the approach to creating good content and valuable episodes is very simple. You just bring on very smart people. You put microphones in front of them and you turn them loose. And that's why I think that Sheila and Shazma have seen such interest in their podcast. It's called the Doc Talk podcast, if you want to check it out, because I think people, Gizmo in here saying common sense isn't always all that common. People want to hear like a straight talking, plain talking, credible voice on stuff like this, and I think that they do a good job. I also want to thank everybody that's left comments and that's talked to us about that menopause episode. We did know that it would resonate with people. It's a little bit different than some of the other content that we put out there, but it just obviously a very valuable conversations. And please do keep those comments coming. We also invite you, if you're watching our episodes or our highlights after the fact, to leave a comment on our YouTube channel on the specific episodes, and that includes our conversation just one episode ago. This was on the 15th of May with Philippe Fournier. He's a poll aggregator, also happens to be like a rocket scientist and a physicist as well, but a poll aggregator, and he was talking to us about talk of Alberta's separation and how it could actually destroy the UCP. I was blown away by polling from Angus Reid that he was sharing with us that shows that more than 60% of UCP supporters that were polled would support Alberta separation. In other words, a majority of UCP supporters would support Alberta separation. You got to watch the full episode. You can find it wherever you get your podcasts, or you can find it, of course, on our YouTube channel. But I think the numbers were off the top of my head, wasn't it 62% of UCP supporters polled supported it, and 3%, I think it was, of NDP supporters supported it. We've been getting a lot of comments on it on our YouTube, and I wanted to read some of these. Killer Dude 151 says, people forget that UCP only won by roughly 1,200 votes, spread out over 5 or 6 ridings last provincial election. So not only is the party at risk of splitting, they're at risk of getting blown out entirely. The premise of the conversation is that if a majority of supporters of a political party are behind the province leaving Confederation, you're going to chase a lot of people away from the party. If the party starts being known and recognized and portrayed, and some of you would say misportrayed, but if the party is portrayed as the separation party, every single person that feels strongly or even has an inclination that Alberta needs to remain a part of Canada is going to leave that party. I mean, I like I said yesterday, if I'm a UCP supporter here, I am sounding the alarm. This is red flag territory, right? Steve Goad in our in the comments in YouTube says almost every nation in the world dislikes all talk of separation because if foreign secession is supported in any way by the government, then they risk allowing it at home. Says the economic chaos, the fear that post-division causes collapse in investment, which is true, lack of recognition by other nations. He says, Montreal used to be the big city in Canada, but businesses left in droves for fear of separation. Says business hates instability. Says the European Union punished the UK because of Brexit. Scottish nationalism is waning because North Sea oil is rapidly decreasing, and anybody that thinks that secession will bring more prosperity is living a fool's dream. April says, in 72 years, I've never voted Conservative. I live in Alberta. The separatists can pack up and take their ideas south. Gary Mello, I wonder if that's his real name. Gary Mello says Smith is deflecting from scandals in the party with the separation talk. Reedham says some Albertans love the premier. Seems it's the ones that have been rage farmed and fed alternative facts from the grifter. And Michael Bartley says the real threat to national unity is the Toronto Maple Leafs. Says after last night's game, talking about their game with Florida, the blowout loss, everybody wants to distance themselves from Toronto. That from Michael. I did see Coop in our live chat earlier saying that, how about the Jets last night, staying alive against the Dallas Stars with a big win.
That's awesome.
Another
Amazing.
shutout for Connor Hellebuck. We've been seeing all these goalies that have been called into question. Hellebuck, obviously he's going to win the Vezina Trophy, could win the Hart Trophy as league MVP, but he's struggled these playoffs. He's really struggled on the road. And then Stuart Skinner as well in Edmonton. Both goaltenders that have really been called to the carpet have pitched 2 shutouts in recent games. Yeah. Both of them.
Yeah, especially Hellebuck. Like, you can't beat him in that building. And I was watching last night. Oh, my gosh. They're so loud there. I would compare, like, I think Edmonton and them, I mean, all the Canadian teams, the Leafs, Montreal, all our barns are so loud compared to the American ones. The American ones, like, hands down, Vegas has the best in game. I will say that, like, I know the Oilers
Edmonton
do an
used to have
incredible
it.
job, but like, it's the entertainment capital of North America, perhaps the world. So they're doing crazy stuff in there. There's pyro, there's all sorts of ridiculous stuff going on. We have pyro too, actually, guys. But I will just say that, like, all the barns in Canada, like, they sing along more. They're louder. And yeah, I thought the Jets were done. I still think it's hard to win 3 in a row at this stage of the playoffs, but like, I more than anyone want to see Winnipeg and Toronto move on, because it's looking more and more like that matchup we don't want, the one with all the asterisks over it that we know worked out bad for us before, which is Hurricanes Oilers.
Yeah. No, I've seen people chomping at the bit. They want the Hurricanes again. They want to avenge the 2006 Stanley Cup loss. Game 7.
That's a team though that I look at and like they look at all the other teams. Edmonton, Dallas, Florida, the Leafs, they've all got these mega stars. Austin Matthews, Matthew Tkachuk, Connor McDavid, Mikko on Dallas. Like, they've all got all these. Name me a star on the Hurricanes.
Well, Sebastian Aho's pretty good.
Name me another.
Well, I'm not.
That's
that
what I mean.
familiar with
It
the
takes you a
Hurricanes.
minute when you say the other teams.
Svechnikov, that young Russian, he's good.
But this is a band of guys who are not necessarily huge names. Yes, there are some amazing players on their team.
Yeah.
But they just seem like a team that is, we don't have those guys. We don't have the glitz and glam. We are the grinders, and that scares me a lot.
Yeah, fair. Kenzie in here says, she says it's been entertaining to watch people shouting at Premier Danielle Smith for causing and supporting separation talk when neither is remotely true. Listen, the Premier, if you missed our interview on the 8th of May, you can see it. Danielle Smith joined us with an exclusive one-on-one live in the Real Talk studio. You can find it. That's our episode, the 8th of May. On YouTube, wherever you get your podcast, and we talked about her. It's basically all we talked about with her for 20 minutes, talking about her legacy. Is she really prepared? Is she serious about being the Alberta Premier that pulls the province out of Confederation? We get into it. And she's been clear. She says, and she said it in front of a microphone very, very many times, she says her Canada includes Alberta. She does not support Alberta separating. But on the flip side, she's made it much easier for Albertans, as you know, to garner 177,000 signatures on a petition to trigger a referendum. And then the referendum would go from there, and we'd see what happens. And so people are looking at that. It's Bill 54 for the nerds and geeks like us. They look at that, and they say, well, she's making it a lot easier for separatists. That's true. She's also making it a lot easier for anybody that wants to trigger a referendum on anything else. And I saw that former Deputy Premier Thomas Lukazik yesterday is filing a petition. He's going to kickstart a petition. He's going to try to get 177,000 or more signatures to counteract this, to prevent Alberta separation. We'll get Thomas back on to talk about that when the time is right. I'll also let you know that we do have an interview request in with Jeff Rath, who's the lawyer who's leading the Alberta Prosperity Project. He has yet to respond, but I have no reason to believe he won't come on the show. We'll pick his brain. He's the one that wants to lead Alberta out, and I've got a lot of questions for him as well. But Kenzie basically says that Canada and Alberta have suffered from instability for a very long time, and says secession, or Alberta separating, is partly to bring stability. I don't understand how that would bring stability in any context. It would uproot everything. But I do recognize that there are people, there are a great number of people. There's probably a majority of people in Alberta that are sick and tired of a decade of Liberal rule, and they're obviously very concerned that the Liberals won the last election already, and they kind of want to leave. They want to take their ball and go home, and they want to leave. But I don't know that stability is the answer, or is the word that I would use in this circumstance. A respected position, you can always send me an email. If you think that I'm an absolute idiot and totally out to lunch, let us know why. Don't just hurl the insults. Tell me why.
Like,
in other words, in this, buddy, I've been called an idiot for 48 years technically, but make the argument. Like, I would love, and in good faith, and we'll read the emails. We'll read them on the show. I would love to know how that would provide more stability. I think all it does is invite instability in almost everything, including export markets, including the finances of the province, including the costs it would take on. I don't know if people saw this, but Corey Hogan, the recently elected the MP out of Calgary Confederation, obviously, I guess the now former, or maybe he's on leave or whatever his deal is, but the co-host of the Strategist podcast, obviously a former VP at the University of Calgary who's just resigned to step into this new role in Ottawa, on his Substack. You can check it out, or just coreyhogan.ca. And he lays it out why Alberta separation, in his opinion, is not a good idea. He says it should fill us with moral concerns. It presents countless treaty concerns. He says it represents an attack on the Canadian experience. But here's where he goes on, and here's where the rubber hits the road, and here's where I think the conversation needs to focus on. He says, there are some false, inaccurate, or dubious ideas that are being circulated. Number one, the idea that a sovereign Alberta could force Canada to build pipelines to the coast, or the idea that a sovereign Alberta would have more money, or that the idea that a sovereign Alberta would always have a conservative government. He goes on and he talks about it all. And I encourage you, regardless of where you land on this issue, to check it out. That's coreyhogan.ca. Also got an email from Jim, who is watching the show in beautiful Vernon, BC. A shout out to you, Jim. And he caught our conversation, our most recent episode. That was the 15th of May with Dr. Bob Murray, a political scientist. And Bob knows more about foreign policy than anybody else I think I've ever met. He's very passionate about it. He owns the nerd and geek title like the rest of us. He gets into the nitty-gritty, and he helped us understand what Mark Carney's cabinet picks say about Canada's approach to foreign relations, to foreign policy, to diplomacy, to our relationship with not just the United States, which we spent a lot of time talking about, but China and India as well. And we talked in particular about Carney's tapping Anita Anand on the shoulder to serve as Canada's Minister of Foreign Affairs. And Jim writes in and he says, I entered your discussion with Dr. Bob after my morning walk. Thanks, Jim. Says, as he was mentioning Anita Anand as Canada's new foreign Minister of Foreign Relations, says, I don't think that there's going to be any significant change from when Chrystia Freeland held that position under Justin Trudeau. Says, as a political scientist, in quotes, Jim says, in my perspective, there's nothing scientific about higher degrees in politics. But Dr. Bob speaks well and presents a broad perspective, he says, but he didn't really nail down any specific details on Canada's foreign policy. I encourage you, this is now Jespo talking, I encourage you to watch the interview. I think that he did give us some really interesting takes on like how you deal with China and India right now, on how the game has changed a little bit. He says, but with Minister Anand, she's not much different than previous ministers in that same portfolio. She's a strong supporter of Israel, and she does not recognize that their actions in Gaza constitute genocide, even though the reading of Article 2 of the Geneva Conventions is readily clear and free of doublespeak and confirms that Israel's actions are genocide. Jim, I will note that one of her first comments on the record, interviewed by journalists shortly after swearing in as Minister of Foreign Affairs, was about Israel, and was about Israel withholding foreign aid, in particular food, from people in Gaza. So it's a start. She's on the record there. Anyway, Jim says the discussion also touched on Canada's role in NATO. It did. Dr. Bob got into military spending and the expressed desire on the part of the Americans as well as domestic supporters to increase Canada's military budget from 2 to 5% of GDP. Canada is fully tangled within the U.S. military, ranging from supply materials and soldiers to supporting the Americans' belligerent actions overseas. Jim says NATO should have been disbanded back in the early 1990s when the Soviet Union, the Warsaw Pact, had dissolved, and what was left of Russia was on severe downward economic slope under Boris Yeltsin and U.S. tutelage, but that's a whole different discussion. Jim says Anand committed Canada to buying the F-35, the fighter jets, in a $19 billion initial sale with lifetime costs totaling nearly $90 billion. That's a lot of housing. That's a lot of infrastructure. That's a lot of social services and healthcare. And she said at the time, the F-35 is the modern, reliable, agile fighter used by our closest allies in missions around the globe. Jim says it's none of that, as its track record so far shows that it's still not fully operational, not stealthy, as claimed, requires huge maintenance time, and is not suited for flight under various weather conditions. He says, Dr. Bob continued discussing Canada's need to diversify its foreign trade in light of Trump's foolish tariff war. In 2022, Anand supported Canada's deployment of warships to run freedom of navigation exercises through the Taiwan Straits. Not exactly a friendly way to diversify trade with the world's largest economy. Jim, I would note that 3 years is a lifetime in global politics. He continues and says how quickly it seems to be forgotten that Canada held Meng Wanzhou, the daughter of global corporate giant Huawei, an executive, under house arrest for nearly 3 years at the behest of the American government. If Canada is to diversify, China needs to be included in the process, and our record so far is clearly hostile and in the hands of American foreign policy. That from Jim in Vernon, BC. Appreciate the points. You made a ton of them. We'll let that land with the audience, and I suspect that we may hear from Real Talkers responding to that down the line. As we wrap this episode, and each and every Friday, our wonderful friends at the DQs of Northwest Edmonton and Sherwood Park implore us to present our hottest takes. These are all real emails to talk@ryanjespersen.com. It's the Flamethrower, presented by the DQs of Northwest Edmonton and Sherwood Park. Kids, you need to get your earmuffs in or just leave the room because Real Talkers are all fired up today. Les says, with regards to the federal cabinet, Mark Carney did not establish a ministry for people with disabilities and inclusion. I wonder who will be responsible for the new Canada Disability Benefit. Les says, at least Justin Trudeau thought of us. How about this one from Taylor, who says, Premier Smith, everything that you're talking about right now is not representing me as an Albertan. Everything you're saying right now was not campaigned on during the most recent election. You need to call an election right now and let Albertans have a say about your leadership. That's from Taylor in Calgary. How about this one from Michael, who says, this flamethrower is going out to the second worst politician in Alberta, and that's the Minister of Transportation, Devin Dreeshen. Devin, why don't you take your... Oh, boy. Sometimes reading this just feels a little weird because I am talking about a minister of the crown. These are Michael's words, not mine. In the flamethrower, Michael says, why don't you take your MAGA hat and fuck off to the United States forever instead of dicking around with our perfectly fine traffic laws. Because of this Donald Trump sycophant, I've got a ticket for $175. Ooh, Michael's all fired up. He says, you see now that the Edmonton police can't use red light cameras for speed due to this completely incompetent prick. So instead, they're setting up tricky transition points like going down Walterdale Hill. That's in Edmonton, a road heading into downtown or out of downtown. He says, that's where I got busted going 70 in a 50 zone for 2 seconds before I realized that I was speeding and started to slow down, but not in time to avoid the laser. Michael says, I don't even blame the cops who pulled me over, although I was obviously choked. Albertans, wake up and get rid of this brutally corrupt government. Michael says, I did not watch my buddies die face down in the muck. He says, oops, sorry, got a little overheated there with the big Lebowski reference. He says, hat tip to the many Lebowski references on Real Talk over the past few weeks. That from Michael. Michael, we hope that you've found some time to take a deep breath and chill out. And this one from Sunil, who writes in and says, Jespersen, I wish you would have called out Markham Hislop on your most recent episode when he claimed that projections and future modeling is not evidence. Evidence is something that is derived from past experiences and observations, Sunil says. So you had to call that out. You didn't, but, says the electrical engineer, Sunil, I still love you. Sunil, we love you too. We love all of you that take the time to share your hot takes with us in emails to talk@ryanjespersen.com. We want to know what you think about what you're hearing or not hearing here on the show. It is proudly presented every single week by our friends at the DQs in Palisades, Namao, Newcastle, Westmount, and Baseline Road. They're going to be on the 10th tee box serving up their Dilly Bar shooters at the Real Talk Golf Classic. That's coming up on the 19th of June. It's a Thursday at the Ranch Golf and Country Club. You can register today on the events link at ryanjespersen.com. Hey, keep it on the rails this May long weekend, everybody. Stay safe, and we'll be back Tuesday morning with the Hub's editor-at-large, Sean Spear. We'll see you then.
Real Talk is hosted by Ryan Jespersen, executive producer Josh Dunford, technical producer John Hicks, general manager Katie Cook-Chivers, account coordinator Lawrence Derlego, human resources Lena Shepard, website design Mike Johnston, voiceover by me, Carrie Skelton. Real Talk's editorial board is Supriya Dwivedi, Ahmed Ali, Brandy Morin, Ann Castleman, Corey Hogan, Harmon Candola, Catherine O'Neill, and Chris Henderson. Member Emerita, Julie Rohr. Real Talk is recorded in Edmonton, Alberta on Treaty 6 territory, the traditional and ancestral territory of the Cree, Dene, Blackfoot, Saulteaux, and Nakota Sioux, home to the Métis settlements and the Métis Nation of Alberta. Real Talk is a relay project. For more, check out ryanjespersen.com.